One of the commonest reasons why parents bring children to doctors today is because of cough. And cough has become a recurrent phenomena. A common cough, cold, fever is seen so often in children that almost every child would have at least 6 to 7 episodes of cold, cough and fever. The issue which crops up in every parent's mind is why this recurrent cough, and the issue which crops up in the doctor's mind is this recurrent cough just a simple viral infection or is it asthma? So there are two things that we are talking about here. We are talking about recurrent viral infections, which is seen in children, which is benign, which comes with simple runny nose, cough and fever, lasts for anywhere from 3 to 7 days and the child is fine. Typically seen when children go to play schools or nurseries where they interact with each other and pick up these viral infections. But there are some children who would cough really badly. The cough is worse at night. It sometimes comes without fever. In fact, most of the time it comes without fever. These are children who may have excessive sneezing, sometimes may have red eyes, they may have an itchy skin with some rashes or an allergic rash on the skin. And these are children where there may be a family history of asthma. So this group of children, what I'm going to talk to you about is asthma in children, which is not uncommon, but in fact it's on the rise. Now, as a parent, when should you think that your child has something more than a regular cold and cough? So if you have a family history of anybody having wheezing and the child has recurrent cough which is predominantly nocturnal, that is more in the night, gets worse with exercise or gets worse if the child is exposed to a trigger like a strong perfume, a dust, or maybe just change in weather. So these children who have cough which is nocturnal, with or without breathlessness, recurrent episodes, and with or without school absenteeism, with a family history of allergies, asthma, we are thinking of probably asthma. Now, what is asthma? So asthma is a disease of sensitive airways. So these are airways which get swollen, red, and produce a lot of mucus in response to a trigger and causes the child to cough or get breathless. Typically it runs in families, though a genetic link has still not been identified. These children respond to medications which are called as bronchodilators, and when they are very severely affected or when they are breathless, we at times need to use steroids to control the episode of breathlessness. What is extremely important is this is a disease which can be very well controlled. And the ideal way of treating a child who has asthma and who has symptoms which are severe, recurrent, and probably lasting more than a week and coming on every month, these are children who need preventive medicines. Preventive medicines are in the form of inhalers, which are given through spacers with or without a face mask, and your doctor can demonstrate to you how it can be used. These inhalers help prevent an attack of asthma and can improve the quality of life of such children. So my dear friends, if you have a child who's coughing recurrently or who has symptoms that I just mentioned, you must bring in your child to consider a possible diagnosis of asthma, and inhalers is the best way to treat such children. Inhalers are of two kinds. The one, as I mentioned earlier, is to control the disease, to prevent an attack. And the other kind of inhalers are so-called relievers. Now, relievers help you during an acute episode of wheezing. And when you use these medications during an acute episode of wheezing, these children get instantaneously better. It's a myth that inhalers are addicting, they are strong, and they are not the correct method to treat a child with asthma. In fact, it's just the contrary. So, inhalers deliver medicines in small quantities directly into the lungs and help the patient prevent an episode of wheezing. Also will relieve a patient of wheezing if the child is wheezing. It has hardly any adverse effects because it goes directly into the lungs and really does not enter the bloodstream. Prolonged use of inhalers to prevent an attack of wheezing or prevent asthma attacks could get the child to lead an absolutely normal life. So, inhalers is the mainstay of treatment and it is the first step in treating a child with asthma. And they are not addicting at all because none of the drugs that are there in the inhalers have a potential to cause addiction. So the other important mainstay of treating children with asthma is avoidance of triggers. And one of the most important triggers that I would like to mention is cigarette smoke. Parents who smoke, mothers who smoke while she's pregnant or while she's carrying the baby, cause the child to become an asthmatic. And that is one thing I would surely say that one must avoid. So triggers are very many. It could be strong perfumes, it could be dust, it could be smoke, it could be vehicular exhaust, it could be damp walls which is growing fungus and molds. But one person's trigger may differ from another person's trigger. A family where there is a history of asthma, breastfeeding offers some protection to the baby to prevent development of asthma. So if I were to conclude to say what are the three most important things in managing asthma, the first is continued breastfeeding, avoiding exposure to triggers, especially cigarette smoke, and use of inhalers.